Hello, good morning. Um, Had a request to go over menstrual cycle. And let's look at diagram that we saw in class. So let's look at this and let's make this a little bit bigger. Okay. So when you're looking at the menstrual cycle, we're looking at it academically in 28 days. So there's different ways to look at it if you look at this chart. So let's break it down. The first kind of question that I could potentially ask is, how thick is the endometrium? So in the menstrual phase, that should it be its thinnest because that's where it starts. There's a sloughing off of endometrium, and then it opens up all of these arteries and veins. And of course, you'll have some bleeding. And that's the menstrual phase. That's day 1 through 5. So if I ask the question, what is the thinnest part of your endometrium? It should be around what? Day 1 through 5 during the menstrual phase. Now, day 6 through 13, 14 is called the proliferative phase. It starts growing. But the secretory phase, that's when the endometrium is at its peak. As you can see here, it's it's at its thickest. So day 23, 24. So I could ask you on like day 23, 24-ish, is the endometrium thick, thin? It is what? Thick. Another thing I could ask, right? And of course, if there's no implantation, if there's no pregnancy, after day 28, it starts back to day 1. And then the next menstrual phase or the next menstrual cycle. Now, you could also look at it as where does the hormones come into play? So day 1 through 14, through the menstrual phase and the proliferative phase, think what? Orange or reddish orange here, which is estrogens. Day 14 through 28, think progesterone. So I could ask, on day 9, what is the predominant hormone on day 9? And you'll tell me estrogen. On day 20 or 21, what's the predominant hormone? Progesterone. We can also look at it this way as well. The other 2 hormones that are important in the menstrual cycle is FSH and LH. On day 13 of a 28-day academic cycle, that is on like day 13, you'll have an FSH LH surge, which will correspond to a slight increase in basal body temperature, and it signals on day 14 ovulation, where the mature Graafian follicle gets released. Right after the mature Graafian follicle gets released, so this egg goes up and out, and what is left is all this other contents that turns into something called your corpus luteum or luteum. Then it degenerates and then into your corpus albicans. So day 13, FSH LH surge. Day 14, ovulation. Day 13, you'll have a spike not only in FSH LH surge, you'll also have a slight increase in your basal body temperature. And those are the events of the menstrual cycle, and that's probably the most I could do regarding questions. So if any other questions, give me a call.